Hi, this is Eric, and I was going to give you a quick update on my YOYO medical bag. I've not been doing as much on this as I should have been, but I've had several messages asking for an update, so here's what I got so far. I got my medicines in, and so this is, I'm creating a Mylar resealable pouch that the meds will go in. I'm going to put these in some smaller containers because these are too large to squish into this big bag. But we've got naproxen, ibuprofen, acetaminophen. These are all painkillers. Over here are some of the antibiotics. This is sulfamethoxazole, trimethoprim. This is a sulfa antibiotic, also called Bactrim. This one's ciprofloxacin antibiotic, metronidazole antibiotic, doxycycline, one of my favorites, antibiotic, clindamycin, that my son's on again for another one of the skin infections, penicillin, so that's kind of the antibiotic spectrum. I've got ondansetron, which is also Zofran for nausea and vomiting, prednisone, mostly for allergic reactions and asthma, acetazolamide, this is for acute mountain sickness, prevention actually, more than treatment. Some loperamide for diarrhea and some hydrocortisone cream. Now, I still need some other things like antibiotic ointment and some fungal foot powder. I need my albuterol inhaler to put in here. And so those are kind of the meds. So the bag doesn't have nearly as much in it as I need to. I've got my lights here, and alcohol preps, some gloves. Here's some basic equipment. This is a otoscope, ophthalmoscope to look in ears and eyes, a blood pressure cuff, stethoscope, trauma shears, a CPR mask, and you can see the rest of that one's unfilled. IV bags and supplies. This is a survival bag, blizzard bag. Great for hypothermia, but kind of chunky and big. And here I have my ETA kit and EpiPen. So this is extremity tension pneumothorax and airway kit. If you want to know what that looks like, it's just a Ziploc bag. It's got the tourniquet, the combat gauze, the two large angicats for a pneumothorax, and a nasal airway here. There's also a backup pair of gloves in this pocket, so this is going to be some acute life-threatening stuff that goes in here. I have some extra hemostatic dressings. I've got my dental pack, got fire steel and a scalpel. Again, this may not be the permanent configuration of all this mess. I'm still working on it. This big bag hold on. Alright, kind of tight, hard to do with one hand. But this is going to be my airway. In case I need to run and go do something but don't want to carry the whole bag with me. These are my intubation blades. And I've got my more standard endotracheal tubes here. And then I've got a full set of all sizes over here. But what's in here is most likely what I'd come across. My SAM splint, I'm going to make this sort of my ortho major injury wound kind of bag. I have a bougie to help with intubations. This is basically just a long rubberized tube that you can put through the vocal cords into the trachea and then put one of these breathing tubes over it in case you have a difficult airway. And in this back pocket is personal protection, gloves, gowns, that sort of stuff. But I still have a lot to put in here. I've got a lot more on my list that I need to obtain and organize, but I've just been a little busy and haven't gotten around to it. But anyways, that's the update of where I am right now. As I put more in here, I will try and be better and get another update out pretty quick. Thanks.